The following video is based on the research done by Group 8 on federal and state prison health systems. The video exemplifies this research through a skit about an inmate's first prison assignment. Here is his story.
Hello, Drake, aka Dreezy.
Yep, that's me.
Okay, well, our firm was called recently to talk about your current arrest, and they informed us that you might have bronchitis or you're self-diagnosing yourself with bronchitis. So we just wanted to talk you over the prison healthcare system.
I've been battling this cough ever since I got in here. I just feel like no one cares. I feel like I might turn into a serious illness.
Let me just put it into perspective for you about where you stand in the healthcare system in prison. So there's a lot of stats, especially with the U.S. Department of Justice and the Bureau of Justice Statistics. So there's about 1.5 million people in federal and state prisons altogether. And of that, it's broken down into about 200,000 in federal and 1.3 million in state. And so you being a male, there is 180,000 men in federal and 1.2 million in state. And then your women counterparts is 13,000 in federal and 100,000 in state. So when you think about this in perspective, you're one out of either 180,000 or 1.2 million, depending on where they put you, if you go to federal or state, depending on your offense. And then there's also statistics that are based on a 2002 survey of inmates in local jails and a 2004 survey of inmates in state and federal correctional facilities. And they look at whether it's a chronic condition or a mental illness. And your bronchitis, if it's bronchitis, could be determined as possibly a chronic, depending on how long you've had it. But federally, there's about 38.5% of people that have chronic conditions. And in state, there's about 42.8. For the mental, there's about 14.8 in federal and 25.5 in state. So I know you're kind of feeling ignored a little bit, but when you think about it in terms of the whole thing, your bronchitis might not be their top priority. Does that make sense to you?
Yeah,
okay.
I still feel like I need the care though.
Well, we'll look into it, okay?
Hello, Dreezy. So I hear from my associate that you might have bronchitis. Can we backtrack a little bit and just tell me how you contracted this bronchitis?
Well, I think I got it the night that I committed my crime.
And what was your crime?
Well, I stabbed someone because they stole my lunch money.
Okay.
It was a cold December night. It was snowing, obviously. Late at night, wasn't wearing the proper clothing. My mom always told me to wear a coat and a hat. Just never did it, and here I am.
Well, you're in a really good situation right now because back in the day, there were no prisons. So you should thank the Pennsylvania Quakers because they're the ones that started the prisons in the first place, or else you would be dead because the death penalty was the only option. The Quakers got the idea from the present day prisons from Bridewell, which was a palace that started into a workhouse, which just made people that committed crimes like robbery and stabbing people for lunch money to just like work and have things like not enjoyable. But those workhouses turned out to be like even worse than the death penalty because people were dying really slow deaths. And so you should be grateful because you only have bronchitis.
Only have bronchitis? I can't stop coughing.
We're gonna help you figure it out. We're gonna help, I promise you, but just give me a couple minutes and we'll figure it out for you.
Okay.
But if you fast forward a couple years, a couple hundred years, when prisons were overcrowded and cruel, reforms had to start happening. So after World War II, JFK realized that prisoners such as yourself were being ignored and started to initiate policies to get better taken care of. So again, thank JFK now.
Thanks, JFK.
Then you fast forward a few hundred more years to the court case of Estelle versus Gamble, which said that the failure to provide adequate medical treatment to prisoners constituted cruel and unusual treatment. So prisons needed a better health system, and the prisoners deserved to be taken care of. Now a few more hundred years, and we have the Affordable Care Act with the inmate exclusion policy. So now, whenever you can apply for Medicaid, and when you get out, then you can like immediately get care. But it's going to be harder for you to get care in prison because you don't have as much money and you don't have coverage. But Medicaid's not going to take you off, completely terminate you, but they're just going to suspend you while you're in prison.
So what's this inmate exclusion Medicare policy thing?
So it's on Medicaid, and it's the inmate exclusion policy, but it's just saying that you can still have Medicaid coverage, but not while you're in prison. So they just suspend you for the time that you're here, and then you can get coverage right when you're released. But usually, before the Affordable Care Act, it was just you were completely terminated, and it was hard for you to get health care once you left, or once you were released from prison.
So how do I get health care in prison?
Well, it's a bit iffy because you're located in the Missouri prison system, and you may be required to reimburse the prison for all your medical expenses depending on your ability to pay.
So you're telling me that if I have to seek treatment, that in the future I'm going to have to pay back all that money that it costs?
Like I mentioned, the reimbursement cost depends on your ability to pay after your sentence. So you may be able to pay your full amount of care, or they decrease your payment depending on your financial situation. And some prison systems require you to make co-payments before you even get the medical care. And this means that you can be asked to pay anywhere from 50 cents for each visit or $50 for each visit.
How am I supposed to pay that? I'm making 12 cents an hour out in this field scooping up cow poop.
Well, the money for your co-payments will come out of your commissionary account, which is the account that your family can put money in, and from the work. But and it seems unreasonable. I recommend that you seek health care when you need it, not when you just feel like going to get it taken care of. That way, when you return to society, you're a healthy individual with a lower risk of other health problems.
So it sounds like even though it's expensive, I probably should still go and get coverage.
Yes, that's a good question. I'm glad you brought that up. The use of co-payments is to prevent prisoners from abusing their health care services. This way, prisoners are required to make a payment before they try and receive any medications or anything else that they need. I'm not saying that you would do this, but prisoners may think that they can get away from faking an injury or sickness to obtain prescription drugs, which can cause substance abuse. Co-payments are also used to help pay for the services that you're receiving. However, these payments are too low to help pay for the healthcare services provided. For example, Virginia paid nearly $160 million for medical care, but only received $500,000 from prisoners' co-pays.
I know I might be dumb, but that doesn't make any sense to me. It's pretty obvious that the co-payments aren't going to equal the cost.
You aren't dumb, you just made poor life choices. But you're right, the use of co-payments will never be able to fully pay for the cost of healthcare. This is why prisons have brought in private healthcare providers.
Private healthcare providers? What are those?
Private healthcare providers are an outside organization that are brought into the prison to give healthcare. Prison systems did this thinking that they could decrease costs by eliminating healthcare providers that are employed by the state, which would decrease benefits and pension costs.
So you're telling me the treatment I'm going to be receiving very well could be from an outside provider? Is that going to affect me at all?
Unfortunately, the use of private healthcare providers does affect you. These outside providers view healthcare as a business, meaning they look to make money instead of giving the best quality of care. Therefore, the quality of care that you receive may not meet the standards or may be unsatisfying. But many of these companies are under investigation by federal judges and human rights groups.
So you're telling me this bronchitis might be around a while?
Unfortunately, yes.
Good to know.
So I hear that my associate Abby went over the basic overview of the prison system. So now I'm here to talk to you a little bit about how to navigate the healthcare system.
Yeah, could you explain it more? The lady in the red dress just didn't make it understandable for me.
Well, when you first arrive, you'll be provided with a preparatory health screening. So within the first 8 hours, your weight, height, and vital signs will be documented, and then any necessary treatment, medication renewal, or detox will be arranged. We'll also screen your mental health and assess your suicide risk. We also must screen you for tuberculosis, and then we'll give you information on how to access your entitled healthcare services, which can all be utilized for only a small copay fee.
What comes after that?
Within 14 days of your arrival, a medical provider will complete a comprehensive health appraisal, unless one has been done within the last 90 days. In this appraisal, you will receive all necessary lab tests, immunizations, and screenings. Also, you will be screened for HIV and hepatitis B and C, and we will educate you on the prevention and the risk of exposure. We will also refer you to a qualified health professional to meet any specific needs you may have.
What happens if my bronchitis gets worse and somehow I end up with a gimp limb and need physical therapy? Does that service cover?
The chances of that happening are pretty small, but yes, it will be covered for a small copay fee. You can also request mental health services, dental services, and even reconstructive surgery. If this facility doesn't have what you need, we can transfer you to another facility, or you can pay for outside services on your own, but remember, you don't have any insurance.
Sounds like I'm in a bad situation. I might not ever get better.
Well, there are definitely weaknesses in the system. About 14% of federal inmates and 20% of state inmates get no medical exams since they are first incarcerated. There are also many people that leave prisons and return to their communities without having their health issues addressed, such as HIV, AIDS, hepatitis B and C, and tuberculosis. And this can be a major threat to the communities, and it's definitely something that needs to be worked on. But the prison system is not entirely terrible. In 2001, the Supreme Court, through the case Brown v. Zapata, decided that not receiving health care while incarcerated is legally cruel and unusual. So in a way, having health care at all in prison should be seen as a major positive. The incarcerated population is actually the only group that has the constitutional right to health care. Plus, a lot of the time, the care that is provided in prison is the only care those people receive at all, because they're not able to access it outside prisons. And a lot of people with mental illnesses are also able to receive the treatment that they wouldn't be able to otherwise.
So even though it's not a good situation, I should be grateful that I'm given the care.
Definitely.
Inmate 3Z, I'm here to take you to your cell.
Thanks for the explanation.
Unfortunately, Drake ends up not working enough hours to cover his healthcare expenses. Therefore, his bronchitis got out of hand. Sadly, this could be the case for many present-day inmates.